Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Good morning, everyone. Welcome. Today, I am starting my plans. My goal is to get family stories out so families who listen to me will understand that they are not alone. Families who are going through what could be a trauma will hear stories of other families and what they've been through. And hopefully that will inspire other people to keep following their instincts and fight for their kids. Hopefully, more importantly, it will inspire providers and practitioners to learn as much as they can to support families, to understand the issue of tongue tie, to dispel the myths. There's so many myths around tongue tie, and get the facts out. So today I will be talking to someone whose story really touched me when I get a lot of DMs, and thank you so much for DMing me. I get lots of them. But Sarah, her story really touched me because it was, let's put it this way, and she'll tell the story. But to me, it was an extreme outcome that probably could have been avoided if the professionals that Sarah took her baby to, number one, listened to her and had any awareness of the possible repercussions for tongue tie, right? So this is not just about breastfeeding, and we don't learn about it in school. And mostly, I have learned from all of you, and I think other providers need to be open to that too. So let's see if Sarah is here. I think I saw her joined. Okay, here she comes. Hi, welcome, Sarah. Thank you so much for being with me here today.
Thank you for having me.
And from the people that are following, listening to us today, I want to thank you
in behalf of them, because I have a feeling that your story is going to touch a lot of hearts and affect a lot of people's ideas about tongue tie being just about breastfeeding, and tongue tie being something that we can just live with or ignore or not need to learn about. So thank you.
Okay, so I guess on October 16th, 2014, I gave birth to my fourth child, my second daughter.
Mm-hmm.
And I breastfed her right away, like I did with my other kids. And she didn't breastfeed for long, but everything seemed fine. And during my time in the hospital, the nurses took a look, the pediatrician took a look. They said, this latch looks great. Looks like what we see in a textbook.
And did it feel okay to you at that point, or
yes.
did something it felt
yes.
okay? Mm-hmm.
Yes. And that's what's very interesting about my whole story is that the latch looked and felt fine to me the whole time. It was just she wasn't gaining weight. But
mm-hmm.
So when she was released, they noted a weight loss, but they didn't say too much about it. I mean, our family's not predisposed to having large babies, so
mm-hmm.
It wasn't. They didn't really red flag it or anything. And then when I had her first visit with the pediatrician, I guess it was later that week, her weight was the same as discharge weight.
Mm-hmm.
I don't think it was at that point that the pediatrician said anything. She said, come back for her 2-week visit. So we came back for the 2-week visit.
Can I interrupt you? At that point, yes. When she was nursing, did you have any idea that it wasn't going well? Like, what would parents look out for that you might have been experiencing? Did she have good diaper output?
I think so. I mean, this was 7 years ago.
Yeah, and this was your fourth baby.
She was my fourth,
taking care of 3 kids at the same time, right?
Exactly. And my next youngest was only 20 months older. So
okay. So you had your hands full. Yeah.
Exactly. So I think at her 2-week visit, she was still the same. And I think it was at that point that the pediatrician said, you need to be doing both sides in 15 to 20 minutes. So I tried to go by that, except those 15 to 20 minutes took an hour because she would fall asleep on the breast.
Mm-hmm.
That was really, and I had no nipple pain. Usually when people think tongue tie, they think chomped up nipples and pain. I had none of that.
And did he advise you to see a lactation specialist, either a IBCLC or a counselor or anybody at that point?
I don't remember. At some point I was told to pump to see if it wasn't a supply issue. I know that's not necessarily a good litmus test, but I did pump and I got, I forget but how much exactly, but I did make contact with a lactation consultant in the community, and she said, this doesn't, she clearly doesn't have enough energy. I don't care what they said about her latch looking normal. I mean, of course, she never laid eyes on my daughter at any point. But she said this all to me over the phone. You need to start supplementing. And she said, I told her how much I had, because I called her thinking it was a supply issue. And when I told her how much I pumped, she's like, no, that's gold. That's a lot. I forget how much.
So in other words, you had milk, but she wasn't able to extract it.
Exactly. And having to the hospital where I delivered, has, with COVID now, I don't know what the current status is, but for a long time they had a breastfeeding support group where, you come with your baby and feed, and the lactation consultants from the hospital would be there and they could work with you. They had a scale, you could do a weighted feed, and she pretty much always transferred well, but when I would take her to the pediatrician, she wasn't gaining weight. But to backtrack a bit, when I spoke to this lactation consultant, she said, you need to supplement, and not with formula. She said, I'm pumping, I'm getting a lot. I should give her an extra ounce after each feeding, and then hopefully that will give her more energy and she will be able to nurse better.
Mm-hmm.
So we did that, and it worked. And then I don't know if it was, at some point when I went to the breastfeeding group at the hospital, one of the lactation consultants said, you have your hands full, you don't need to supplement, she's fine.
Oh, no.
So I stopped. And, unfortunately, I wish I had her whole weight chart in front of me, but I don't.
Mm-hmm. No, it's okay. It's okay. It's enough to get. So she started. It sounds like she started doing okay, and then she slid down again.
Yeah, and then I started supplementing again. I was supplementing, and I was feeding her like very strictly, like I think 8 times in 24 hours. And the answer was something else. She started sleeping through the night at like a month old, much earlier. Happened to me. My other kids all started sleeping through the night around maybe 2 months. She started sleeping through the night very early, which a lot of people think, oh, great, that must be wonderful for you. But yes, I had to get 8 feedings in about less than 12 hours.
Right. And not only that, but she might have been sleeping because she wasn't thriving at that point.
Exactly.
And I hate to use that word, But she was hanging on okay, but she wasn't thriving to her full capacity. And a lot of babies shut down. Like they just like, oh, I might as well sleep. And they're happy to be in that state of not getting quite as much as they need.
Exactly. So, but she was meeting all her other developmental milestones. She smiled on time, all that stuff. And then I would go to the support group, the group at the hospital most weeks, and I would just weigh her there and be able to track her weight gain. And I remember at some point she was not gaining so much. I know she wasn't gaining not even an ounce or maybe a few ounces.
And can I ask you a question? During all this point, were you suspecting that something was wrong with her? Were you starting to research and learning about tongue tie and thinking it was a possibility?
Not really. Interestingly, and I have not told you this, I knew a little bit about tongue tie because this could be a whole nother, I have 4 kids. So my oldest is 14. My next is 11. My next daughter's turning 9, and then the daughter who I'm talking about is now 7.
Yeah. Mm-hmm.
So my 11-year-old, his weight gain was fine, but he was chomping my nipples. He needed to nurse all the time. He was not a good sleeper, but he gained weight. So at that point in time, I did meet with a lactation consultant, and granted, he's 11, so this was that long ago. She said, I don't think she used the word tongue tie. Mm-hmm. She said he has a short frenum, but he'll grow and it'll get bigger. Mm. I mean, eventually it did stop hurting.
Right.
Yeah. The jury's out on him. Maybe he's 11 at his age. I don't want to talk about him too much because that's not why we're here, but there's just.
But you know what? It's interesting because this is one family with 2 completely different presentations, right?
And then, my oldest, the jury's kind of out on him. He did have some painful breastfeeding, some other things, but he has hearing loss, and so we were dealing a lot with that. So he has cochlear implants, so we were dealing a lot with that. And and then my daughter's, her birthday's next week. She's 9. Interestingly, with her, the breastfeeding was painful maybe for the first couple of days, but she just breastfed every 4 hours like clockwork. She was fine, but she definitely had some myofunctional issues. She sucked her thumb for a while. I mean, and interestingly, when I forgot how old she was, we were at the dentist. The dentist was like, "Oh, she has a thick lip frenum." I'm like, and at that point, this was actually after
so you knew
about this with my younger daughter. So. Yeah. She does seem to have a thick frenum on her lip and tongue. It does not appear to be causing any functional issues. We're actually doing expansion with myself, her, and my daughter, and my other daughter right now. And the dentist we're working with said, let's see how expansion goes, and then we'll see what we need to do. Because
anyway. So getting back to your baby, at what point did it become an urgent issue where you knew that something had to be done differently?
Well, when I realized that she was just not gaining very much, I called her pediatrician, and she said, "This doesn't sound. You need to be giving her more from a bottle. There's just no way that she's feeding this much." And she was for a while. Like maybe the last feeding of the day, I'd be like, "Yay, we're done," and then she would throw up. Mm-hmm. That did stop, and that's like now I don't remember if this was before or after. I think it was after. When she was around 6 weeks old, I reached out to a private lactation consultant to do a visit with her, and she didn't really look at my daughter's mouth that much. I explained to her, sometimes she falls asleep at the breast. She's very slow. She's not gaining weight. I don't really know. It was, very vague symptoms. So she did suggest the possibility of a tongue tie, but she didn't really look at the tongue that much. So she suggested a particular ENT in the area. I had heard of him. So I went to him, I guess, the following week, and he said she didn't have a tongue tie. But she did have a lip tie, but lip ties don't affect breastfeeding. But I want to release it because it might cause a gap in her teeth. And I said, I need to think about it. Mm-hmm. So, I never went back to it. So I was just back and forth with my pediatrician. We were doing weight checks. I did when she told me to pick up more about I was pumping and giving her more in bottles. At the beginning, it worked. And she was like, "Oh, this is great. Just keep doing what you're doing." I'm like, "But I'm feeding her all the time and doing, what they call the triple feeds, or, sometimes I'd give her a bottle and then nurse her to make sure she was getting enough." And I also started to notice when we were doing the triple feeds and just giving her 1 ounce, maybe 2, earlier on, it was okay. But, once she got to 1.5, 2 ounces, it was just like she got tired. She just like it was just like she couldn't do it anymore. It was just like
right. So she couldn't take the volume that she was expected to take at her age. So I just want to interrupt and explain to people who don't know what triple feeding is. Triple feeding, first of all, it's supposed to be just an intervention of short term.
Exactly.
It's not a feeding. I never, ever, ever tell somebody to triple feed for more than 3 days, 4 days maybe, because it's unsustainable, because your quality of life matters too. And if the triple feeding, meaning pumping, bottle feeding, and putting the baby to the breast, if the triple feeding isn't doing its work in that short time, then something else is going on, and we have to change our plan. So what you went through, hopefully, well, a lot of people are still being prescribed to triple feed by people who have no idea what they're telling them to do, and it's not really sustainable. So I'm sorry that you had to, have that struggle, and still nobody was giving you the answer of, well, why isn't this baby, why can't she handle the flow? Why can't she handle the volume? Why is she getting tired? What's going on for her? So when did you finally get an answer? You had to hit rock bottom first, right?
Yeah. So then after this visit where things seemed to be looking better, we went back for, I figured if it was like a regular checkup or a weight check, her weight gain had slowed down. And I said to the pediatrician, I said to her, look, I am doing nothing all day but feed her. And she said, well, you're not, basically our family is not so large, based on our genetics, I just keep doing what you're doing. And if she stays on a curve, then fine. And then I don't know if I saw her. The pediatrician she herself was pregnant, and by the 4th month checkup, I had her 4th month, this daughter's 4th month checkup together with my other daughter's 2-year checkup. She was out, and we actually had to reschedule it for like a week later with a nurse practitioner. And I don't know if it was I think it was at that visit. I mean, I had mentioned that she was throwing up and she stopped, but she wasn't spitting up a ton, but she was spitting up more than my other kids did. And she's like, oh, well, I think she has reflux. And I was thinking, this just doesn't sound like reflux. And she prescribed reflux medicine.
So she was put on medication at that point.
Yes.
Okay.
And then I think I forget based on what I followed up with this nurse practitioner, and she said, okay, you need to see a GI, a pediatric gastroenterologist. It happened to be at Johns Hopkins. I live in Baltimore, Maryland, and at Johns Hopkins at that time there was a GI who actually specialized in infant feeding issues. I called and tried to get an appointment with her. She was booked out months in advance. I mean, she happens to be she's bad at state. She's not even there anymore. But who knows if she would have picked up on this. But they were like, oh, but this one has an opening next week. And I said, okay, fine. So, and actually by this point, I should also mention I had been in touch with my pediatrician and then later with the nurse practitioner. Is that these triple feeds? My daughter's just started rejecting bottles altogether. I was trying different nipples. The pediatrician suggested trying different nipples. Yes, because she would, because I was trying using the Medela nipples because that was just easy because that with my pump and the containers, so I could just feed her right away.
You had quite a journey and quite a job. Okay, so now we're talking of she's like 4 months old and she's refusing bottles.
5 months. Yeah. So about, and I guess she was probably around 5 months when we went to the GI, and the GI said, I'm a proponent of breastfeeding. Why don't you? She suggested that I add, some powder, some formula to her to fortify her bottles with formula to give her some extra calories. And I was like, but she doesn't take bottles. How's this going to happen? And I was like, I'll just keep trying. And I had tried, I used Playtex drop-ins with my other kids, even though I breastfed them primarily. When I had to give them the bottle, we generally would use the Playtex drop-ins. So I tried those. She didn't she maybe took it the first time and then she stopped. I even tried the Tomo bottles. I don't know if they make those anymore. She didn't really go for those either. And also because my daughter also had, this was probably, interestingly, her lack of nutrition never seemed to affect her development, but I guess this is why she had a very nasty cradle cap. I mean, her skin was almost coming off. Like, you could see, like, it was like, and she had, like, what was said to be eczema. I'm not convinced that it was really eczema, but her skin was totally, did not look
so she might have had some food intolerances going on at the same time.
Well, I don't know. That's what this GI said, avoid dairy and soy. You try some, she changed the dosage on the medicine, give her, put some Nutramigen in her, that's, very sensitive sensitive formula. I mean, more sensitive ones in her bottles, and get back to me in 2 weeks. So I think she gained a little bit of weight. She lost a little bit of weight. Anyway, the only time I was ever able to get her to take a bottle was she was basically asleep. I got her to take a little bit.
But at this time, she would still come on your breast.
Yes, exactly. She wanted my breast. She was up pretty obvious. But why she wasn't gaining weight, we weren't sure. And then I guess when I got back to her about 2 weeks later, I said that her weight had gone up. She lost a little bit of weight, so it was pretty much about the same as it had been at that first visit. And then she called me and said she needs a supplemental feeding tube. She needs to come to the hospital.
I'm sorry.
And that was. And then I guess that was a Tuesday, and we went in late Wednesday afternoon, and we were there until Friday. She was able to gain weight she had an NG tube. She was able to gain weight. I did kind of ask, why can't she take it orally? They're like, we don't know. We're just trying to see if her digestive system is intact. I was, well, what can you test her for allergies? They're like, we don't test at that age. I'm like, well, celiac, because a friend did suggest that. They were like, nah, it's hard. I mean, having to be the nurses were, the nurses were like treated us very well, so I can't really, can't say I had a bad experience in the hospital. At this point, I kind of was I was dealing mostly with GI. I started thinking about the tongue. They're thinking about the stomach.
Right.
And, they did actually ask if I wanted to meet with their lactation consultant. I said, sure, why not? But I never saw her. So, and, maybe that was for the best. Who knows? And so when they discharged us, they gave me instructions for how to, maintain and change the NG as needed. And they said they have Johns Hopkins as a nice home health system. They had a pediatric OT. They said, we'll send an OT to your house to help work with her on taking bottles again. And, they're very nice. They were really a pleasure to deal with. And then, so sometimes I would go to the pediatrician for weight checks. I kept going to the breastfeeding group. She was gaining. What I was supposed to do was try to give her 5 ounces from a bottle, and then whatever she didn't take, put through the tube. And then I was supposed to give her, continuous feed overnight.
And how long did she have the tube in for?
A total of about 3 months.
Wow.
Yeah, 3 months. She went into the hospital on April 1st, and she pulled out her feeding tube for the last time on July 11th. Why I remember that, I don't know. But, and so, but I was just, I didn't want to deal with the tube. I was like, it's taking her an awfully long time to finish 5 ounces. It was taking her an hour to finish 5 ounces, and I would do different things. I would rewarm it. I would try to minimize distractions. I had my other kids around. It was really not so simple, but it would just take her often take her an hour to finish a bottle, except for when we were having our evaluation. Hopkins pretty much, in a situation like this, they automatically refer us to infants and toddlers. In New York, it's what they call early intervention. And we, she didn't qualify. But it happened to be, she was really in terms of her physical development, everything else, she was
right. So now you've seen how many different
at the evaluation, she happened to finish she happened to polish off a bottle in 15 minutes at her evaluation.
Wow.
But she never did that again. Right. So finally I said, this is I feel like this is just a holding pattern. No one's telling me. We don't know why. What's going to happen. Right. So I had heard about a feeding therapist in our area, who people really liked, and I thought, let me try calling her. So it took a couple tries to get through to her. I think this was by the end of May or beginning of June, and it took me a few times. I got through to her finally, and I was giving her my daughter's entire history on the phone, and she stopped me in the middle and said, "Have you ever checked for a tongue tie?" And I said, "Well, yes, Dr. So-and-so said she didn't have one." And that she had a lip tie, but lip ties don't affect breastfeeding. She said, well, everything you're describing is consistent with tongue tie, and you need to get a second opinion, ASAP. Because she's developing oral aversion. They're probably going to try to start suggesting a G-tube.
Right.
So she explains that, that tongue ties could cause reflux because they're taking in air.
Exactly.
And also I forgot to mention we did get the go ahead from our pediatrician, from the nurse practitioner, because the pediatrician was still on maternity, to try solids. She seemed like she wanted them, but she just couldn't swallow them. Like she would just gag it, or spit it out.
So
that's probably why she's having a hard time with solids.
Yeah, and that's on the way to oral aversion, because a kid who has a hard time protecting their airway when they're eating doesn't want to eat, right?
Exactly.
Because it's dangerous for them and it feels scary. And so many kids get labeled as picky eaters or fussy or behavioral disorders, when it's really that they're afraid to eat because they're afraid they're going to aspirate. They're afraid they're going to choke because they can't control the way that bolus of food gets sent down to where it's got to go and get swallowed.
Yeah, because then
so how old were you? How old was the baby when you had the diagnosis of tongue tie?
She was about 7.5 months.
7.5 months. Wow.
Almost 8. But the thing with solids is it's like there's so much that went on that I don't always remember it all in one fell swoop. But I was in touch with the GI, and I said, she wasn't taking rice cereal so well. She's like, you don't have to start with rice cereal. Just go to purees. I tried that. It was the same thing. And so that was a Friday when I spoke to this feeding therapist. I asked if I should go to a particular pediatric dentist who I had heard about, and she said yes. And she, as soon as she got phone with me, she texted me his information. I called. I got an appointment for the following Thursday, and then on Monday they called. That Monday they called and said, "We have a cancellation. Can you come today?" I said, "Okay." And I'm not going to say it was magic. It did not. We still had feeding therapy for a few months. She still had the tube for another month. Her weight still went up and down a little bit. We had to work with her. I was worried about reattachment. I went back to the dentist. He said everything was fine. It seemed like the issue was we were trying to wean her off the reflux medicine a little too soon, body work has me now. Their body work is more readily available in our area. At that point, it wasn't so much. So body work. I really wish we had.
What I'm hearing from you is, and this is typical. The later that the therapies start, the harder it is for the baby to get back on track where they should be, because now she had been doing a certain thing with her tongue and her posture and everything for all these months, right? And so the longer that goes on, the harder it is to go back. I get so many questions from parents who say to me, "It's too late, right?" And my answer is, it's never too late. I had my tongue tie released after I was 50.
I had mine released this past summer.
Right. So it's never too late. You just have to think about the work around it being increased before and after in order to get the results. And now we do more than we did 7 years ago with pre-body work and things like that.
Exactly. But we didn't even have, like I said, it was, in our case, it was kind of an emergency. I wish, we had to do it when we did. Yeah. I really do wish that we could have had some sort of functional assessment beforehand to get baselines, because that is tough. She definitely, can I say, do I know if her, actual breastfeeding got better post-release? I'm not sure, but I can tell you she did shortly after take off with solids.
Okay, great. And, so she did what she needed to do for her age, which is that's what function is.
And this feeding therapist said that there were things that, because I had been told, she has a high palate. That's what lactation consultants at the hospital group said. She does have a high palate. I didn't know that a tongue tie causes that, but this feeding therapist, when she worked with us at post-release, she explained all that to me, how it can. And she said there are things you can do, but she's kind of at the end of the age range where it can be done, to lower the palate,
and that's not true either. We know that. Now you know that. Right?
Well, I'm saying the way I'm saying in terms of sticking her finger in her mouth or something that would create an oral. In terms of that, is it was she was kind of getting too old for that. She's now she sleeps in a Schwartz appliance, which getting her to keep it in is she's been better the last few days.
So the good news is that she doesn't have a tongue tie. She gained weight. She's good, right?
Yeah. And
so what message would you like to say to parents who are having struggle with weight gain for their babies? What would you have wanted to tell you while this was going on? If somebody could have spoken to you and said, "Sarah, this is what you need to know," what would it have been?
I guess that it's a tough question. I mean, obviously, I wish someone had told me that weight gain could be a sign of tongue tie, because usually when we hear tongue tie, we hear about pain and nipples and and nipple damage and painful latch. But I wish that it seems like the medical community. I mean, again, this is the feeding therapist said this. Is more focused on the number on the scale than about why. And it's great when yes, the barometer. It seems that the barometer of a baby's health is their weight gain, but and there is some truth to the fed is best mentality. But I have said this. Fed is the problem. The where it falls short is fed is not best if it is masking us from figuring out what an issue is in the first place.
Right. So what you're saying is what I often say is, we can put Band-Aids on the problems, but if we don't find out what the problem is, then you're not solving the problem. You're just pushing it down the road.
Exactly. You're just like what I compare to is that you don't, if someone suspects someone has a broken femur, you don't tell them take Tylenol and call me in the morning. If you don't put a Band-Aid on a broken femur. Right. You have to. Yeah.
Right. And what I would like to say, hearing your story, the message is that the parent's experience matters.
Yes.
Right. And nobody was listening to your experience. Here you are, a mother of 4, taking care of a medically fragile baby at this point, trying to balance your other kids, doing everything you could for this baby, and it still was like you were knocking your head against the wall because things weren't improving, no matter what you did. But you shouldn't be the one responsible for it. So as medical providers, as healthcare providers, as anybody who takes care of moms and babies or pregnant people or kids in the first year, we should all be aware of all the signs and symptoms and be aware of the parent's experience as part of the assessment.
Yes, and this ENT happened to be this ENT before I don't really know how much he looked in my daughter's mouth, but he, I don't like to say that he didn't look hard enough. I don't really remember, but I do remember that the dentist spent more time than, can I say he didn't touch the tongue? I don't remember, but he didn't. I don't remember looking for him.
But you know what?
He tried to explain to me how tongue ties affect breastfeeding, and I was like, you're not describing my daughter at all.
Right. And not only that, you wouldn't want the ENT who didn't think that a lip tie mattered or didn't understand that there might be a tongue tie. You don't want them doing it. You don't want to talk anybody into doing
That's
a
what's
procedure.
So sad is the feeding therapist said, oh, he has a history of this, and 7 years later, people are still lactation consultants and pediatricians are still sending people to him.
Right. And there are some ENTs that know what they're doing. Yes, I don't want to bash any. But
yes, I'm a big fan of Dr. Gahary. I was reading this whole time I was kind of reading up on his stuff, and I was like,
So Dr. Gahary, there are others. So it's not that we're not against ENTs, but there are certain, in general, the best provider to go to is a pediatric dentist. But before that, your lactation consultants failed you as well. And I apologize for my profession. And I spend most of my life trying to educate lactation consultants so that this doesn't happen. Because we don't learn about this in school. It's not our fault that we don't learn about this in school. As a nurse, as a midwife, and as a lactation consultant, I learned this much about tongue tie, and it was about the anterior in the front tongue tie. It wasn't posterior tongue tie. It wasn't anything about how the function was with breastfeeding. So,
and it happens to be at the hospital where after my daughter had her release and I was still going to the breastfeeding support group at the hospital. I mean, mainly to get her, it was really mainly for the purpose of weight, but getting her weighed. But they would have pediatric residents helping out, and when I would go after the release, one of the lactation consultants said on at least one, maybe 2 occasions, she told the resident, sit down, and she told the resident to tell the residents my story.
Right.
How much it'll help has it shaped them? Can I say that it helped them?
It can't hurt. It can't hurt.
Know.
And
I don't know.
Yeah, that's one of the reasons why I wanted to discuss this with you today, because us professionals can talk to us all we want. If we don't hear the experience of families, we're not going to really learn.
Yeah.
So Sarah, thank you so much for being with us today. Is there anything else you'd like to add?
I guess just to also say that in the end, my pediatrician happens to be, like I happened to was like right at the beginning of COVID, she left the practice, but she really, I have to say that is she talking about tongue ties with her patients at her new practice? I don't know, but she, and I didn't just, she wasn't dismissive. She's not like the horror stories you. She didn't say anything that bad about tongue tie. She didn't say, "Oh, it's not a tongue tie." She, in the end, she was willing to admit that she really didn't know and she didn't realize. And she really, in the end, when she saw that my daughter was, when she came back from maternity leave and my daughter's weight was picking up, she said, "Whatever you did clearly worked, and good for you for seeking all that out yourself."
Right. Excellent.
That's why I say a good pediatrician is not one that's going to have all the answers. A good pediatrician is one that respects you as the parent and is willing, cares more about your child than their ego.
I love that.
I mean, there are many wonderful pediatricians out there, but in the end, she respected me for. I mean, I remember the day I was going to the pediatrician, I just called and left a message. Said, "Oh, by the way, I'm taking my daughter to have her tongue released today," and she, I've heard some stories that even afterwards, the pediatrician's like, "Nah, it wasn't the tongue tie. It just, it's just timing. Right. It's the elimination diet. It's this, it's that." But she said she really feels that the tongue tie, but releasing the tongue and lip tie made a difference for my daughter.
Well, I'm glad that your story had a happy ending. And, I wish you and your daughter well. And thank you so much for coming on today.
Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.